If you have not been diagnosed with breast cancer, would you consider doing a double mastectomy? You may have heard that a few celebrities have done this. In this video, we will analyze the research data surrounding this to discover if this is an operation you might consider. If you are thinking about this issue, this video will cover what you need to know and the questions that you need to ask. I will first discuss the relevant details, and towards the end, consolidate the salient points to provide additional clarity. So for those who are thinking about the operation, or if you are doing research to help a loved one decide, please stay till the end. Double mastectomy is also referred to by medical professionals as bilateral mastectomy. You may already know that this involves the surgical removal of both breasts, which may or may not be followed by reconstruction. Those of you who know me may be surprised that I am discussing bilateral mastectomy, as I am a strong advocate for breast conservation treatment for women who have already been diagnosed with breast cancer. Be that as it may, there are circumstances under which bilateral mastectomy may be considered for women who have not been diagnosed with breast cancer. As one who is dedicated to evidence-based surgical treatment, I am happy to explore and share the data that is available for this clinical scenario. Firstly, you may wish to know that the available evidence has been reviewed by the Society of Surgical Oncology Breast Disease Site Working Group. For this video, we will focus on high-risk individuals. Personally, I was very excited to learn that guidelines have been updated on this subject, and I'm keen to share this information. I am also grateful to the members of this working group who have put in much effort to produce this document. So, without further ado, let us begin. Some of these terms may be new to viewers, and I will do my best to explain them. A woman may have certain conditions which confer an elevated risk for breast cancer development. In such cases, she may wish to consider bilateral prophylactic mastectomy, also known as bilateral risk-reducing mastectomy, which is the removal of both breasts in patients without a known cancer to reduce the risk of cancer development. The medical abbreviation for this procedure is BRRM, for bilateral risk-reducing mastectomy. It is commonly referred to as double mastectomy amongst members of the general public. Based on the information presented in this article, we will focus on and explore the risks, benefits, and alternatives to BRRM for women with family history and genetic alterations. The first question we would ask is, who should consider bilateral mastectomy? Those who are at high risk of developing breast cancer may wish to consider BRRM. High-risk individuals include those who have certain genetic changes, referred to medically as pathogenic variants, or PV for short. Depending on the gene type, these individuals may have a 20 to 80% lifetime risk of developing breast cancer. Having reviewed the data for such individuals, the work group made these recommendations. BRRM may be considered for individuals who have a high-risk breast cancer gene like BRCA1, BRCA2, or TP53, or in certain moderate-risk genes like CDH1, PALB2, PTN, or STK11. Individuals who have a strong family history assessed by a genetic counselor and those with prior chest or breast radiation therapy before the age of 30 may also consider BRRM. Briefly, risk-reducing surgery may be considered by individuals with the pathogenic gene variants listed here, as well as these other personal circumstances. The next question to ask is, of the individuals known to be at high risk, are there any who should not undergo BRRM? Not all individuals at high lifetime risk of developing breast cancer should undergo BRRM. The work group has identified contraindications to the procedure. Contraindications refer to clinical circumstances which would make the operation inappropriate. Women older than 70 years of age, even with BRCA gene mutations, may not benefit from BRRM. There may be a case for a younger age limit if a patient has already been diagnosed with ovarian cancer. In addition, if a patient has other medical conditions which places her at surgical risk, it may not be appropriate to undergo mastectomy as an elective procedure. If you are considering BRRM, please see a doctor to discuss fitness for surgery. So for high-risk individuals, BRRM may not be appropriate for women who are older than 70 years of age. Those who have medical conditions putting them at high risk of anesthesia and surgical complications also should not undergo the procedure. Let us now discuss the benefits of BRRM for high-risk individuals who are medically fit for the operation. Bilateral risk-reducing mastectomy is effective in reducing breast cancer risk by about 90 to 95%. However, we should also be aware that there is no evidence that BRRM improves survival when performed for the majority of breast cancer risk factors. The benefits should be weighed against the potential complications of surgery, and we now ask the question, what are the potential complications of this procedure? The risk of complications of undergoing BRRM has been reported to be between 15 to 34%. These include infection, hematoma, which is a collection of blood-stained fluid in the surgical field, seroma, a collection of tissue fluid, skin necrosis, or wound disruption. To put the risk of surgical complications for BRRM in context, in comparison, 1.74% of patients who undergo breast-conserving surgery experience postoperative complications. Based on these reported percentages, double mastectomy with or without reconstruction is associated with a higher risk of complications than other operations for breast cancer. In addition to postoperative complications, women may also wish to understand if there are quality-of-life issues in the years after completing surgery. While there are reports of general satisfaction with high psychosocial well-being and decreased anxiety after BRRM, it was also noted that there were decreases in physical well-being, increased body and breast pain, and some effect on sexual well-being. In a study evaluating the impact of BRRM on women with high-risk genetic predisposition, it was found that while prophylactic surgery significantly reduced concerns about developing breast cancer, it may come with a price of reduced physical well-being and surgical risks. In an attempt to understand quality of life after bilateral mastectomy, this study showed that about 50% of women had some negative impact related to quality of life, sexuality, and body image. Putting the benefits and risks of BRRM together, researchers have found that there is risk reduction of breast cancer development by up to 95%. But women who wish to undergo this procedure should be aware that this might be at a cost of a 34% risk of surgical complications and a negative impact on the quality of life in up to 50% of women. As there are potential downsides to undergoing double mastectomy for women at high risk, some may not wish to do the procedure. In such cases, are there alternatives to risk reduction? The answer to this question is yes, there are alternatives, and it may be helpful to know that surgery is not the only form of risk reduction. Women at high risk for breast cancer may choose to undergo intensive imaging screening with annual mammogram alternating with annual magnetic resonance imaging, or MRI breasts for short. There are also risk-reducing medications like tamoxifen, which can be taken in combination with imaging screening. So, to summarize and consolidate the points in our discussion on bilateral risk-reducing mastectomy, with respect to the indications for the procedure, women with high-risk genetics or chest irradiation at a young age may wish to consider double mastectomy. Women who are older than 70 years of age and those who have serious medical conditions should not undergo this procedure even in the presence of genetic alterations. BRRM reduces the risk of breast cancer development, but this may be at the cost of surgical complications and a negative impact on quality of life. There is an option of intensified imaging screening and medication if a woman at high risk chooses not to undergo surgical risk reduction. Thank you for staying till the end of the video. If you found the information helpful, please like, share, comment, and subscribe. You might also submit a request for more details on the articles cited in this video at the Just Medicine website through the link provided in the description below. Stay tuned for more content on the surgical management of breast cancer. Until we come together again, take care.